I'm going across now to my colleague Sameer Dikshit for more on this. We'll also be joined by Dr. Ishwar Gilada to speak on what can be expected now from the Omicron. Let me first go across to Sameer. Sameer, what is the latest coming in? Do we know what was discussed in this crucial meeting?
Yes, Tamanna, good evening. You mentioned absolutely correct that this important meeting is taking place at a time when these Omicron cases, they are rapidly increasing in our country. More than 230 cases have been registered in India. But yes, the good part is that out of these 230 plus cases, 104 cases, they have been properly treated and the patients have been discharged. Now this important review meeting that is being chaired by Prime Minister Modi himself, what we are getting to know from our sources that first of all, the Union Health Ministry, they gave a detailed presentation to the PM regarding the availability of vaccine to various states, the pace at which this vaccination exercise is going on. As of now, more than 140 crore vaccine doses have been administered in the country, and more than 60% of population they have been covered under the full vaccination program. So a detailed presentation is given by Health Ministry regarding the vaccination. In addition to this, the Health Ministry also apprised the PM that yes, India might be in a better situation as of now, but if any third wave knocks the country, then how far the states are prepared and what all the central government guidelines are. So the availability of hospital beds, ICU bed, liquid medical oxygen, or the oxygen availability, that is also being discussed. The medical staff, the drugs availability to the states, that is also being discussed in this important review meeting. Another key issue that is discussed is the booster dose. Now we all know that medical fraternity is requesting the central government to allow the rollout of this booster dose, and now it has also become a political issue also that many opponent political parties, they are raising that booster dose should be allowed. So this is also being discussed in this important review meeting that is chaired by Prime Minister Modi. What we are getting to know that the Niti Aayog official is apprising the PM regarding the COVID vaccine, its efficacy on the new COVID variant, and also the booster dose, the global research, whatever the global pharma companies they are coming up with the data, that is also being apprised to the PM. So all in all, government is trying to make out a roadmap that they are quite well prepared in case the situation goes out of control, and they have a well prepared
fair enough. That's important right now. Sure. Thanks for that, Sameer. So the government is taking stock as is necessary at a time like this when we are seeing how fast the Omicron is spreading. For example, in the UK, over 100,000 fresh cases today. Back here in India, another news update which came in earlier is that Madhya Pradesh has now imposed night curfew. So we're back to that phase of night curfew from 11 p.m. to 5 a.m. So that's a fresh input that has come in today. Mumbai, as I mentioned, has 600 cases after at least 2 months as a daily count. Dr. Ishwar Gilada, infectious disease expert, is joining us on the show. Dr. Gilada, great to have you here on ETNOw. Just, your view about the fear of restrictions on the one hand. Are they required in the face of Omicron? Is this the time to start holding back a little? And on the other side, are we actually seeing an uptick in cases where we need to start worrying?
I think we should not have any kind of panicky reaction. We should have a calibrated reaction. A lot of times we react in knee-jerkism. For example, you spoke about Madhya Pradesh. About 3 weeks before, Madhya Pradesh Chief Minister said that when you land in Madhya Pradesh, you don't need to have COVID-appropriate behavior. And suddenly now they have a night curfew. So I think this kind of wavery reactions, they are wrong. What is required is a simple logic that you shut your mouth, use proper masking, avoid large gathering, and take vaccine. Beyond that, nothing much is required. So I think any kind of shutdown, lockdown, a lot of restriction on people will go haywire. Otherwise, people will go, there will be rebellion. Because fortunately, India is a better country. Here we see people having any vaccine hesitancy, or they do not want to use mask, but they do not impose others for doing that. If you look at Western countries, US, UK, they take out a big morcha that we don't want to wear a mask. We will celebrate New Year. In India, nobody does that. So, very strict measures. At the same time, whatever is required, like medical science believes in the chances may be least, you do your best. So, okay, we will all be over prepared, but over preparation is better than under preparation.
Yeah, no, all that is fine, but I want to specifically ask you about the question on boosters. Now, that is under review, and this is a very important policy debate when it comes to India, because we will be closing the year with about 60%, 65% of the adult population fully vaccinated. Our aim was to cover 100% of the adult population. So, in terms of absolute number, sizable number of people who have still not been vaccinated. Do you think that we should focus on vaccinating them first, or give boosters to those who are vulnerable, or do both together?
Tamanna, there is nothing like first, second, or third. Those who have taken vaccine almost a year back, 10 months back, 11 months back, and particularly medical caregivers, you require booster for two purposes. One is to protect them, because they are going to be exposing to high viral load patients. And secondly, to have a kind of a confidence building mechanism that, look, we have given you booster, now be ready. So even that second aspect is more important. A lot of times people going to war, you do a tika. Why do you do? Confidence building mechanism. So similarly, rather than any candle lighting, thali, and all celebration or flower, you provide them booster. But who should be given? When is to be given? Which booster to be used? There is a debate on that. There is a international saying that Pfizer mRNA or any mRNA is a universal booster. We don't have any current mRNA vaccine in India. Moderna has been licensed to Cipla almost 6 months back. It is not available. But Indian-made mRNA is there, which is a Genova biotech from Pune. Their phase 2 trial have shown good safety. Their efficacy trial will come, efficacy data will come within a week or so. And they will be willing to provide any kind of booster. But we should do a bridge trial. And bridge trial doesn't take more than 2 to 3 weeks, at the most 4 weeks. So if they are asked to do bridge trial, then we will know that whether mRNA or Covishield or Covaxin is better.
Coming in today, important data coming in today. Sure, doctor. Thank you for that. Good data coming in today on boosters showing that AstraZeneca, which is essentially Covishield, is working well as a booster dose. So that's good news for us, because that's the vaccine we have in the most supply as of now.